Hi, everyone. Thanks so much for joining us for a special Ask the Experts Q&A. This is HPV Prevention Week, a truly global initiative where we raise awareness for all HPV-related cancers. Moffitt Cancer Center is world-renowned for its human papillomavirus research, and we have two of Moffitt's experts here today to answer all of your questions and share the latest on HPV prevention. Joining me are Dr. Anna Giuliano, Director and co-founder of Moffitt Center for Immunization and Infection Research in Cancer, and Dr. Julian Sanchez, Senior Member of Moffitt's Gastrointestinal Oncology Department. Thank you both so much for being here. And before we get underway, just a few quick reminders for our audience. Please submit your questions in the comments section, and we'll do our best to get to as many as possible. And keep in mind, we cannot offer personal medical advice or make a diagnosis via Facebook. Additionally, Facebook is a public forum, so any comments or questions asked here are visible to the public. I'd like to start out with some of the basics. Dr. Giuliano, tell us about the virus and where we are today in understanding its effects on our bodies.
Right. Well, Pat, thank you for inviting me to this session of Facebook Live. So human papillomavirus is one of the most common infections that we experience, and really all Americans experience. It's around 80% of all Americans, both men and women, at some point in their lifetime have been exposed and infected with human papillomavirus. The good news is there are only a few types that actually cause cancer. And the other good news is that there's something that we can do about it. So we have what are called cancer-causing human papillomaviruses, and they actually cause 6 different types of cancer in men and women. And so for women, it's cervical, vaginal, vulvar, anal, and oropharyngeal cancer. And for men, it's oropharyngeal cancer, anal, and penile cancer.
And Dr. Sanchez, I'll go to you for this one. When it comes to those different types of cancers, how do we typically treat them?
Well, the treatment really depends on the location of cancer, and actually each location has a different treatment and a different screening also. So I think it's really important as we start talking about HPV, as Dr. Giuliano said, the infection is rampant, right? So we know that many people are infected, but thankfully not everybody that's infected gets cancer. So our job as clinicians is to identify which patients are at higher risk to developing a cancer, and then screening those patients who are appropriate so that we can prevent cancers. The screening for each organ is actually quite different. A lot of it involves either cytology, such as a pap smear, or seeing your doctor for an examination. Once we have some method of screening patients, then sometimes we even do biopsies to identify the disease. The actual treatment really depends on where it's located and often involves some degree of chemotherapy, radiation therapy, or even surgery.
And you and I were actually chatting a little bit before this started. It sounds like the screening techniques kind of vary from site to site.
That is definitely true. The oldest screening method in HPV disease, and probably one of the best screens out there in all of medicine, is the pap smear. And that's great for cervical cancer and has done wonderful things across the world in decreasing cervical cancer rates and increasing survival from cervical cancer. We're trying to model a similar screening program in some of the other sites, to some success, but not resounding success. In my site, in the anus, we do pap smears, and we do anoscopies, and we do special examinations to evaluate high-risk patients for any disease that may predetermine their risk for cancer or even promote their risk for developing an anal cancer. That's still developing, probably not as robust as it is in the cervical world. Dr. Giuliano has much more experience in the head and neck world in terms of screening there.
Right. So, Dr. Sanchez, you're completely correct. I mean, the only screening that we currently have, and when we talk about screening, we're talking about at the cervix screening for precancer lesions. So the whole point for cervical cancer screening is to prevent a woman from ever developing cervical cancer. So with the pap smear and with HPV testing, which is what we currently do, we're able to diagnose people in the precancer stage, treat the cervix, return it to completely normal, and prevent a woman from ever having to be diagnosed with cervical cancer. We're hoping to be able to do the same with anal cancer. But there's another type of screening that we can do also, which is more like what we do with breast cancer screening, which is if we can detect the tumor at its earliest stage, then we can effectively treat and cure the patient. And so this type of screening, which I call secondary prevention, is what we're trying to develop for head and neck cancers that are caused by HPV. So this is a very active area of research here at the Moffitt Cancer Center, as well as by others around the world.
That's great information. And we've got some questions coming in from our Facebook audience already. Dina would like to know, should young boys get the vaccine and at what age?
Great question. And yes, since, as you just heard, boys are at risk of developing these cancers as they age and become grown men. So the current recommendations are to vaccinate both boys and girls, starting as young as age 9 and up to age 45. The optimal age to vaccinate is between the ages of 9 and 12. And we say that because that's a time when adolescents are going to their primary care physician, they're receiving the other needed vaccines during the adolescent years. And so it's really simple to just, at a single visit, make sure that your adolescent is receiving all of their needed vaccines.
I think an important message, as Dr. Giuliano was saying, is that this is a cancer vaccine. This is a vaccine that can prevent cancer. We don't have a lot of these in medicine. This is the home run in medicine, right? And this is something that we should really take advantage of. So I think anyone who's eligible should get it.
There's been some, overall vaccine hesitancy in recent years. What do you say to, those parents who might be on the fence about whether or not to get their kids vaccinated against HPV?
Julian, Dr. Sanchez, I think, said it all. This is a vaccine that prevents up to 6 cancers in men and women. Other than hepatitis B vaccine to prevent liver cancer, we don't have anything that's so simple and so easy to prevent multiple cancers. It just seems like an incredibly lost opportunity to protect your family if you don't vaccinate.
And I know, speaking about the young population, but this is approved by the FDA in adults as well. Why is it important for adults to get this vaccine, even in those who may have already had a form of HPV already?
Dr. Sanchez,
sure, yeah.
So,
as we started off the conversation, we talked about how HPV presents in many, many different forms, and there's a bunch of different subtypes of HPV. And the ones we really care about are those subset of HPV types that can actually cause cancer. And that's what this vaccine is attributed to against. In viral and anal, it's just an even smaller number that can actually cause cancer. So I really don't care as a clinician that you may be infected with every other single HPV type out there. If you're not affected or infected with those HPV types that can cause anal cancer, then any opportunity to prevent yourself from getting those is better. So if we can vaccine patients who may have had an HPV infection, but may not have had the HPV strain that causes cancer, then you can prevent the cancer.
So remember, the vaccine we have in the United States protects against 7 of those cancer-causing HPV types. When the very large clinical trials that we've conducted internationally, there has never been a case where any male or female has ever been infected with all 7 of those at the same time. At most, you see somebody is infected with 1 or 2 at the same time, but they'll still derive protection from infection and disease with all of the other types. So even if a person already had a dysplasia, in the case of women, or had what they thought was an HPV infection, they are still going to receive benefit in terms of prevention of disease caused by all the other types. And that's why the FDA has licensed it up to age 45, and why we have national recommendations on how to use it in a very broad age range of individuals.
Great information. And for those of you in the audience just joining us, it is HPV Prevention Week. We've got 2 of our Moffitt experts here answering all of your questions. So please put them in the comments section. We'll do our best to get to as many as possible. We've already had some great ones already. Dr. Giuliano, I believe it was the head of the World Health Organization that has come out and said, he thinks we can eliminate cervical cancer altogether through HPV vaccination. Do you think that's possible? And do you see any of these other diseases, being virtually eliminated because of this?
I definitely think it's possible, and I am not alone in thinking it's possible. Multiple international agencies strongly supported Dr. Tedros in 2018 when he made that statement and essentially created the global goal for the elimination of cervical cancer. And not only agencies, but the World Health Assembly, which is comprised of representatives from every country in the world, agreed to the goal and also agreed to the strategy that he put forth. And that strategy is very simple. It's screening and treatment for cervical precancer and the lesions that are detected during screening, and vaccination. Now, in the United States, since we have gender-neutral vaccination policies, we can go well beyond just eliminating cervical cancer. We can eliminate all of the cancers that HPV causes in both men and women. So we're sitting very pretty in a wonderful opportunity. The published literature has made it very clear. We're now starting to see a significant decline in cervical cancer incidence in countries where they have reached a large proportion of males and females with vaccine. And that includes poor countries like Rwanda and Bhutan, as well as wealthier countries in Australia, the United States as an example, as well as countries in Europe. So the evidence is there. It is very clear. We can accomplish the goal, but we need to first reach our strategy goal, which is to vaccinate 80% of all males and females that are age eligible.
What can we do, in a country that has access to these types of things to help out in some of those areas that don't? Putting you on the spot a little bit there.
Yeah, no, there's a pause because, I think people got tired with the COVID vaccination. So there is some vaccine fatigue going on. But this isn't COVID. This is not a vaccine that you need to keep getting an annual vaccine for, or like flu. I mean, we're talking about 2 doses if it's delivered under the age of 15, once and done, and that is it. And you're preventing 6 cancers. It's just, I think, raising awareness and understanding, and the safety has been made clear. We've had these vaccines in, I don't know, 100 countries since 2006. Incredibly safe vaccine. One
of the things that kind of drew people away from the COVID vaccine was the side effects, and people have reported all sorts of things. Are there any side effects, either immediate or long-term, that are associated with the HPV vaccine?
No, there's the ouch, it hurts. And some mild swelling and redness in the arm, which does not last very long and is so much easier than the COVID vaccine.
That's great. Got a few more questions coming in from the Facebook audience. Sarah asks, in what instances should adults receive the HPV vaccine? Dr. Sanchez, I think you touched on that a bit earlier, but if you just want to reiterate for Sarah.
Really anyone who hasn't gotten it yet under age 45 should be getting the vaccine.
How does the FDA go about determining those ages? Maybe it's not the FDA, maybe it's the researchers behind the scenes, but what is it about those age groups that you're looking for when, trying to prevent HPV?
Pat, that's a great question. FDA is pretty strict. They'll only license in the age range that the trials were conducted in. And it just so happens the trials enrolled as young as age 9 and as old as age 45. Now, in Europe, the European Medicines Agency says, look, let's put some logic to this. We know, we've seen the clinical trial data. It works beautifully in a 45-year-old. We know it'll work in a 46-year-old and a 50-year-old. So they actually have licensed the HPV vaccines with no upper age limit.
And another question from the Facebook audience, Jeremy asks, where's the rest of the world at with HPV vaccinations? Is the US lagging in comparison? I know you touched on that a little bit earlier.
Sure. So 55% of all countries in the world have national publicly funded vaccine programs. The countries that don't have nationally publicly funded vaccine programs are the poorest countries that are struggling to figure out the financing to purchase vaccine. Among the countries that have national programs, the US is lagging, absolutely. Rwanda and Bhutan have reached 90% of their target population with vaccine. We're somewhere around 60%. So can we do better? Absolutely.
During these Q&As, genetics always seems to come up and be a hot topic. Is there any genetic risk factors or links when it comes to HPV?
Not that we know of. There are, it's like we were talking about so far, it's a virus that you acquire through your experiences and your contacts. So there's really no role for genetics for HPV. It is very prevalent though. So that's why I think a lot of people may think it runs in my family. It just runs in the US.
Looks like we've got a few more questions from the audience here. How is the vaccine created? Is it a dormant virus? Dr. Giuliano, you want to take that one?
Yeah, so human papillomavirus is one of the oldest viruses that we know of. It's a DNA virus that co-evolved with humans, very stable virus, and that's why we can develop a vaccine and not have to keep reinventing the vaccine because the virus doesn't change. In terms of, I think it was a latency question, that's a very good question that we're not sure of. There's some literature to show that the virus may go into a latent stage and then reactivate at a later age. There's not a whole lot of evidence for that. It may be a very small part of all people who as adults are infected with HPV. It may be that it was latent and now it's reactivating. But I think, most people who have infections because they recently acquired the infection.
That's great information. And if you're just joining us, we're getting a lot of great questions coming from our audience. So be sure to keep them coming in the chat there. It's HPV Prevention Week, and we've got two of our Moffitt experts here to answer all of your questions. And our next one comes from Madison on Facebook. She asks, do the treatments for HPV-related cancers differ from other types of cancers? Dr. Sanchez, you want to take that one?
In a way, yes. Each site for HPV-associated cancer has a different regimen of chemotherapy or radiation therapy or surgery. In general, when we think of all cancers, those are the three ways we have to treat them anyway, whether that's colon cancer or ovarian cancer. The particular flavor of chemotherapy, though, does change depending on the site. And obviously, the radiation doses do change depending on the site. Most of the time, thankfully, these cancers are well behaving in that the treatments work. Patients, unfortunately, who do develop cancer respond very well to chemoradiation for a large part. Because that's a very curable cancer. So this is why we work in this field, because A, we can prevent it, and if you got it, we can cure you. So this is a very satisfying field for those of us who do cancer work.
Dr. Giuliano, I know you touched on some of the head and neck and the oral cancers earlier. One of our questions has to do with that. Looks like these cases of types of oral cancers are on the rise. What kind of research are we doing at Moffitt to help prevent these types in particular?
Right. Well, we're doing multiple types of research. So we have clinical trials that are ongoing to see how well the vaccine will prevent the infections that cause the oropharyngeal cancers. And those are trials that are operating internationally. We have studies to figure out how to detect these cancers at their earliest point in tumor development so we can more effectively cure. And then we have, within the head and neck cancer program, multiple clinical trials testing novel therapeutics to improve the outcomes associated with treating these cancers.
Dr. Sanchez, could you expand a little bit on the clinical trials we offer at Moffitt, not even for HPV specifically, but what separates Moffitt as a place that you can receive treatment when it comes to these clinical trials?
So since we are a research center, we have treatments, a bunch of research going on in different aspects. So we have some screening research going on how to, like we were talking about earlier, how to prevent you from even acquiring the cancer to begin with, and how can we stop it in its earliest form of prevention. Take it to the next step. We have patients undergoing clinical trials right now looking at what's the best way to treat the cancer. So now you already have the cancer and we have a pretty good way of treating it, but can we do better as a medical community? So we have a lot of focus here on not just HPV cancers, but all cancers, on what is an appropriate and maybe better way than what we're doing right now to treat the cancer with minimizing side effects and maximizing results. And then lastly, we have trials going on a genetic level or on a cellular level, looking at mechanisms of how cancer develops and mechanisms by which we can develop new drugs to combat these cancers in the future.
And we were speaking earlier about some vaccine hesitancy. One of the questions from our Facebook audience is, what would you say to someone that says the vaccine promotes sexual activity in the youth?
Right, there's no evidence to support that. So there has been a lot of research asking that question. It's an important question to ask. And every single study has clearly shown that when you vaccinate a 9-year-old, 11-year-old, 12-year-old, they don't in their minds pair having received any vaccine with sexual liberation or disinhibition. So there is no evidence to support that whatsoever. Then you think about your 9-year-old, they don't even want it. The idea of kissing even sounds so horrible to them. So thankfully, it has not been an issue.
That's very, very important to know. Thank you, Dr. Giuliano. Another question from the Facebook audience. Sarah asks, it's recommended that women above age 30 should be screened with cytology and HPV testing every 5 years, or cytology alone every 3 years. Which option is best?
Well, what is missing from that question is a really important caveat. Women can go to screening every 5 years with both HPV testing and Pap cytology if, and it's a big if they have a history of having had normal screens in the past. So it's only for people who are in this, what we call a low risk group. In terms of which is better, molecular testing plus Pap screening, the evidence is clear. HPV testing is a molecular test to screen for cervical cancer, is superior to Pap screening alone. And when you combine it with Pap screening, that's going to be a more effective screening tool.
And on the topic of screening, we've got another question about screening for the oropharyngeal cancers. I hope I pronounced that right. That may result in HPV. Which type of medical provider should be doing that type of screening and when?
There is no screening for oropharyngeal cancer. If somebody detects a lump on their neck, they need to immediately go to see it. I don't know. So endoscopy, who would it be? It would be an ENT, an ear, nose, and throat doctor.
And those kind of cancers usually develop with patients that have, lumps or swelling on both sides of the neck, something doesn't go away, some bleeding. Really any signs of that, you should see your ENT. They can put a little camera in, even in the office, and just get a better idea of what's going on.
Another question from the Facebook audience. Jeremy asks, is there state or federal government support getting behind this prevention movement?
Yes, so HPV vaccination for individuals 18 and under is an entitlement that's completely covered. The cost is completely covered by the government subsidies as part of a vaccine entitlement. For those who are over age 18, health insurance covers the cost of vaccination as long as you're in the age eligible range up to age 45, including both males and females. With the Affordable Care Act, cervical cancer screening and treatment has now been mandated to be covered. So those screening and treatment procedures are covered and subsidized by the government.
Looks like we got one more question from the audience. Is the vaccine recommended for women who were HPV positive, did surgery to remove the precancer cell, and are HPV negative after surgery?
Yes, and I think we started with that question for all the reasons that Dr. Sanchez mentioned and for the reasons I mentioned. Yes, in fact, our national recommendations are to vaccinate if you're in the age eligible range, regardless of your history with HPV disease.
All right, a lot of great questions today. Thank you so much to the audience. Panelists, Dr. Giuliano, Dr. Sanchez, thank you. And thanks to everyone watching at home. For more information on HPV prevention, please visit our website at moffitt.org.